I've made this video specifically for clinical officer interns who are expecting to start their internship soon. A lot of you have asked me questions regarding internship. Hi guys, this is Coretta. Welcome back to my YouTube channel. If you're new here, thank you so much for coming. If you're coming back, thank you so much. I see you and I love you right back. So in this video, I will answer some of the few questions I've been asked by some of you from my previous video where I shared about a day in my life as a clinical officer intern. I've made this video specifically for clinical officer interns who are expecting to start their internship soon. A lot of you have asked me questions regarding internship, mtu ana join aje, sijui the process and all that. And this video, I've made it so that I can answer your questions. First of all, allow me to begin by congratulating you. Congratulations on your new journey, on your new step. Internship is a very, very great season if you use your time wisely. So let me just go straight into the questions, especially for those who have been placed in Murang'a. Number one, I'd like to know your experience there. Where can I get accommodation? How you went about reporting and requirements, etc. So about reporting, I remember in our time, tuliendanga MOH and then we collected our posting letters and then we were told that we should go to a specific allocated hospitals and get our, what do you call it, the reporting letters, okay? So I remember for me, what I did, we were posted on Monday by MOH. On Wednesday, I came to Murang'a and picked up my reporting letter. So for us, we were given 2 weeks to prepare. And so what we did, my friends and I, we, on that day of collecting reporting letters, we met. Actually, I met with some few other interns who we were chatting in the group. So we met and we started house hunting that day. Okay, another thing is about your license. So for COC, you're expected to pay for your internship license. That was, I think, 4,500. So for us, we didn't pay immediately. Like personally, I didn't pay immediately. I was posted. I paid like in the 3rd month. Yeah. And then immediately when you pay, they post it on your portal so you can download it and have it in your phone. And then in line with that, let me talk about payment. For us, we were not paid like immediately we started our internship. We were paid in the 2nd month. Okay. Yes, we were paid in the 2nd month. So just come prepared psychologically that maybe or maybe not, you might not be paid immediately like in the 1st month. Just prepare yourself for that. And then ensure that you save for your practicing license, because at the end of your internship, you're expected to pay 11,500 for your practicing license. So even as you are, as you go on with your internship life, remember to set aside some money for your license. Okay. Yeah, so I hope I have answered all your questions. In case you have a question, kindly comment down below and I will answer. So as a clinical officer intern in Kenya, what are some of the few things you should expect for a ground? Okay, number one, expect to be a bit confused. Of course, the first few weeks, because you've been out for quite some time, you will need to adjust to the new environment. So for the first like maybe 1 week, you'll be a bit confused, trying to know the hospital, trying to know people, trying to remind yourself how to clerk, how to examine, how to present, and all that. But eventually, you will catch up. For those coming to Murang'a, please, I'd advise you to, whatever date you've been given by the in charge, kindly report on that date. I remember for us, we came, we had a meeting prior to the day of reporting. So in that meeting is where we were organized, our group leaders were selected, we were divided into rotations and all that. And we were also oriented on that day. So I'd advise you that whatever date you're given to come for a meeting or reporting date, kindly make your way to the hospital on that day. Number two, expect responsibility. Responsibility in terms of looking for your own place to stay. You're the one taking care of patients, managing your own life, managing other things of your life. So expect to be responsible, for lack of a better word. So for those coming to Murang'a, nyumba ziko. You will find a lot of rentals around this area because there's a KMTC around, there's Murang'a University around. So there are so many rentals around and they're affordable houses. So most interns live in, there's a nearby town called Mukoyo, there's a place called Mumbi, and now Murang'a town. Most interns live in those 3 areas. And I'm telling you, the houses here, they're just so good, so good quality, and they are affordable. I'd advise you to come early and outsource a place to stay because nyumba huwa zinajaa haraka. As you can see, mmepostiwa wengi, so everyone is looking for a house. Please come early and do the sourcing early. Alafu pia kuna agents. These agents wanawasaidia kutafuta hizo nyumba. Then another thing, expect to make mistakes. this season is new to you. Of course, there are things you're expected to do, maybe you don't know, and you make mistakes along the way. But what I'd advise you is that when you're corrected, don't take it personally. Just take it positively and learn from it and move on. Again, in my previous video, I said the faster you forgive yourself, the faster you move, the more you grow. All right. So expect to make mistakes and take corrections positively. So for those who are coming to Murang'a, we have a very good in charge. Lakini, when you cross paths with him, that's the end of you. Ensure you do what is expected of you. Kindly ensure you do what is expected of you. It's only 1 year. No one is against you. In internship, no one is against you. Everyone is there to support you to learn. But if you don't do what is expected of you, hey, you will have it rough. So don't make your 1 year to be stressful. Just do what is expected of you. If you make mistakes, learn from them and always ask for help. That is why you're an intern. That is why you're not a registered clinician yet. You're an intern to be trained. So be ready to ask for help. Always ask for help. If you're not sure of something, always ask for help. Another thing to expect is long days and fatigue. Of course, you are in the hospital most of the time, and you're always busy up and down, collecting samples, presenting to the consultants, reviewing patients, seeing new patients, clerking patients, etc. So, of course, expect to be tired, but again, remember to take rest. Remember to have good rest. Okay? And lastly, maybe I'd say that expect a steep curve of learning. Like, you'll be learning constantly. Sometimes some things pass you because maybe you're so tired, you're not even listening, but expect to learn intensively. Internship is very intense, and it is only up to you. It's only up to your self-initiative that you will learn. Internship is so intense, and therefore calls for your own personal initiative. And maybe just before I end this video, I want to tell you that you have your objectives. If you don't know your objectives, you can check your logbook. The objectives are very clear. So for you to achieve those objectives, you have to take personal initiative. Hakuna mtu atakupigia simu ingie kazi. No. No one will push you. No one will coerce you to come to work. It's your own personal initiative. So yeah, with that said, I hope this has been helpful to someone. Don't worry. Ask for help whenever you can. And also, requirements, maybe just come with the documents. Our in charge will tell you what to come with. So I think I can't really recall those documents, but well, mtambiwa. So just put your documents right, and basically that's it. So thank you so much for watching. Kindly share this video with a pre-intern. Those of you who are starting your internship next week or next week but one, I wish you all the best and make good use of your time. Thank you. See you on my next video. Bye.